So today we're going to look at Salmonella, what it is and which horses are at risk. So Salmonella is a gram-negative bacteria that can cause infections in a lot of species, including humans, most mammals, birds and reptiles. It's an important cause of disease in horses, and that's become very apparent in the last couple of years, where we're seeing a lot more infections than we did previously. Both on farm and in coming into the hospital. It's a tricky bacteria for several reasons, one of which is it is a zoonosis, so it is possible for the infection to go from the horse to the staff that are caring for them. This is particularly if you're young or elderly or immunocompromised for some reason, or if you've got poor sort of habits of eating around horses, particularly if they've got diarrhea and then not washing your hands before you're eating. It's possible to get the infection yourself. If you were to get the infection, it's a gastro, so fever, vomiting, diarrhea. And in most people, they get over it within 7 days, but in some it can persist for a bit longer. So it's certainly one that you want to avoid. It's a tricky bacteria because it can survive, it forms reservoirs both in horses and in the environment. We'll talk about that through the talk, but particularly a lot of our stud farms, there's areas that are just very difficult to completely disinfect and get rid of the Salmonella bugs. So again, and the other issue is it can survive long periods in the environment. So it can survive up to 400 days in soil. And so again, adding to our challenges in managing Salmonella. It's often resistant or shows multi-resistance to antibiotics. So again, that forms a challenge, particularly if we get it in the joints of foals, trying to figure out what's their best treatment and how to get them to become athletes at the end of it. So how does the infection gets spread around? Well, an infected horse will pass the Salmonella in its feces, and to become infected, another horse has to eat the feces. So if we think on the stud farm, we've got mare and foal pairs. If the mare has been delivering her foal, she often passes feces at the time of delivery. The foal gets up, starts searching around her legs and udder. And that first 24 hours of life, we've talked about it being, the gut being really open in order to allow the colostrum to be ingested and to get the goodness out of it, to get the antibody. However, that really open gut in that first 24 hours is a problem because if they're searching around the udder, they ingest Salmonella-laden feces, and those bacteria through the open gut can get really easily into their system. So that's one way they can get infected. Foals also, sort of at the 7-day mark, 10-day mark, they start eating the mare's feces, trying to establish their own normal flora. If you've got a mare that's shedding, the foal can get infected around that time. So again, adult horses, they rarely eat each other's poo, but mare and foal pairs, again, an extra challenge on our stud farms. If you have a horse that has an infection and has diarrhea, they often congregate around the water troughs, feed troughs, and you may get the feces or the diarrhea being shed over where the other horses are eating, over the hay source, over the grass, and in that way another horse can get infected. It's also possible as staff can carry it from one area of the farm to another. So if you're using wheelbarrows, tools, if you walk through feces and walk around the rest of the farm, it's easy to transmit it from one dirty area to another clean area. So it's really important to be washing your hands and disinfecting your boots, particularly around horses with diarrhea. Rodents, they not only carry it from one area of the farm to the other, it also incubates in their system, and they chuck it out in larger numbers in their poo as they travel. So certainly during the mouse plague, and we were particularly worried about what the rodents were doing around the farms, as I'm sure you guys were as well. Also birds too, and reptiles or snakes. And foals can get infected in utero, so they can also be born infected. So if the mare has the infection and it goes across the placenta, It can get into the fetal fluids, the foal can swallow those fetal fluids, and then it gets to colonize their gut, and then they can get sick pretty soon after coming into the world. So again, there's lots of ways how it gets transmitted from one horse to the other, but yeah, it certainly is a challenging and a very resistant bacteria. So the sources for Salmonella to another horse, probably the biggest source is a horse with clinical disease with Salmonella. So a horse that's blown with diarrhea and is Salmonella positive, it'll be shedding Salmonella organisms in really high numbers. So that's a really leads to really heavy contamination of the environment around them, and they're the ones that you really want to be using your highest level of biosecurity around those, and not, often these horses are sick and they get transported into the ICU, but don't forget where they've come from. So cleaning out the stable entirely, making sure to really get the area clean, and then disinfecting it, and just being careful about anything that was used on that horse, to really, if it can be cleaned, that's great. If it's made of rubber or material that can't be cleaned, then it's preferable to chuck it as opposed to using it for other horses, because the rubber feeders, they can be a source for another horse. You can also get horses which have no outward signs of disease but have been exposed to Salmonella. And these can start, they'll be not showing any clinical signs at the time, it's just incubating in their gut, but they can also be passing it in their feces. So again, some horses look outwardly healthy, but they can be transmitting the disease. And then silent carriers are one of the other sources for other horses, and we'll talk about them here. So a silent carrier, he basically is carrying Salmonella in his gut, and he's outwardly healthy, so no fevers, not off form at all, but shedding Salmonella bacteria either continuously, so in every poo, or intermittently, sort of at different times during the day. But importantly, no signs of disease, so hard to find these horses without testing them. Usually these horses carry it for a couple of weeks up until about 3 months, but then usually they clear it from their system. But during that time, they're a source for other horses, so again, a big challenge. Probably there's studies that have shown only a low percentage of healthy horses are positive, so less than 1%. But yeah, still, even if 1 in 100 is shedding it around your farm, they're still a major problem, particularly again because we know that our foals are very sensitive to Salmonella. In horses admitted to the hospital situation, this percentage tends to be higher because these horses tend to be sick. Studies at vet hospitals have shown that the number of horses that are shedding Salmonella bacteria in their feces on admission to the hospital can be as high as 1 in 10. So there's a recent study out of Massey Uni in New Zealand, but yeah, they show that 10.7% of their horses on admission were shedding Salmonella. We did a similar, looked at in the 2020 season, and 9% of our horses were coming into the ICU were positive on admission. So again, it's quite a lot of horses. In some studies, that number has been up to 24%. So again, it's a risk. It's why we screen or do fecal screening on incoming horses, and we have biosecurity measures in place, trying to reduce the risk of transferring the infection from one horse to the other. We treat every horse as if they're infectious because we just don't know if they are or if they're not. So that's why you'll see us in suits and boots and gloves and everything if you bring a horse into the ICU at Scone. It's a sort of, in human hospitals, the infections acquired in hospital, everything is done to try and reduce the risk that this happens. But there's, if you go into hospital, there's always a risk of MRSA, there's always a risk of contracting COVID. And in a human hospital, there's lots of stainless steel and surfaces and everything can be, easily disinfected. On a stud farm and in a horse hospital, not absolutely everything, is easily disinfected, but everything is done to reduce the horse's risk to as low as possible. So if the silent carrier is healthy, he's probably likely shedding organisms just in low numbers. So that might not be enough to cause infection in another healthy horse. Particularly, probably out at pasture is the safest place where horses can be, and particularly if there's not overcrowding, the horses are a fair distance away from they're not overgrazing the pasture, so that's when they're probably at least risk of getting the infection. But on farms and hospitals, we're often not dealing with healthy horses. We often have sickies as well. And with those, the number of bacteria that's needed to trigger an infection is a lot lower. And particularly our neonatal foals, they're really at risk of Salmonella. They have a naive immune system. They haven't been exposed to it before, and they have difficulty fighting it off. So again, really watching out for these little guys because they are at risk. So a horse is most likely to become ill if it ingests a lot of Salmonella bacteria at once. If it's already sick, it's already stressed. If it's a foal, so again, because they're at high risk, and certain serotypes are more of a problem than others. So Salmonella has over 2,500 serotypes and lots of fancy names, which I'm not going to bore you with, but certain serotypes tend to cause a more severe infection, and one of those is Salmonella typhimurium, which is one that we can help our horses by vaccinating against it. So there's been lots of veterinary studies into Salmonella infections, and they've looked at what sort of risk factors makes a horse more likely to get the infection. So risk factors that lower the number of Salmonella bacteria that if they're exposed to, that they actually get the disease. A horse that's stressed, so a horse that it's come onto a new farm, or it's a change in the herd dynamics, or if it's ill for another reason, that can be enough to stress it out, lower its immunity, and make it more likely to get the infection. Transport, particularly if it's long distance, and particularly if if they've been under stress while they're being transported. So when they're transported, they're moving to a new area. They have a period where their feed is withheld, and they're bonding with other horses during the journey. And when they arrive at the other end, and this is on your own farm, this is why when you take them off those floats, you take their temperatures and you monitor them really closely for the first 24, 48 hours, because it's those horses that can get a transport sickness or colitis, because they can be just super stressed and super unhappy about having made the journey. Antibiotics, we know we use antibiotics to treat infections, and they're really useful substances to use in horses. However, the horse, a bit like humans, has a healthy flora in its gut, and when you use antibiotics, you can knock out that healthy flora and allow bad bacteria like Salmonella to overgrow and then cause infection. There we go. It is one of the reasons why we're always really cautious when using antibiotics, and just definitely, does the horse absolutely need this treatment? Is this the right treatment for the particular infection? And do we absolutely need to use it? Because if you knock out the normal flora and allow another bad bacteria to overgrow, they can get pretty sick with a colitis. Changing or withholding their feed, again, just anything that upsets the flora in their gut. Gastrointestinal motility disorders, so if a horse has had to have colic surgery or has reflux or has an impaction, again, these are the horses that can get Salmonella infections. A recent surgery, so again, the GA and the procedures involved and the stress of it can predispose them to Salmonella infections. high ambient temperatures, again, mainly because horses like us get stressed by it, and wet barn floors. So this is mainly because the Salmonella can, if everything is very wet, the Salmonella can breed and grow, and particularly if the area doesn't get a chance to dry out, you never really get rid of the Salmonella organisms in the environment. So if a horse gets exposed to Salmonella, you can result in a normal horse, so a horse that doesn't get sick, but it is shedding Salmonella around your farm, so that, that's not great. You can get a mild infection, so sometimes horses will just be a little off, go off their feed for a day or two. They might have a fever, sometimes even a high fever up to 40, but they may not go on to blow at diarrhea, but they still can be shedding the bacteria in their feces. You can get an acute colitis or diarrhea, and we'll talk about those in the next slides. Foals, with the foals, again, they don't have great immunity, and what happens when they get exposed to Salmonella is that the bacteria tends to go into their gut and then cross over into their bloodstream and cause sepsis and lead to the infection causing a big reaction in their body and making them super sick, and often localizing out to their joints and growth plates and leading to major problems. So an acute colitis or diarrhea is one of the things that Salmonella can cause. And there's lots of other bacteria that can cause diarrhea or colitis in horses, and even there's factors such as just an upset flora can also cause them to get diarrhea. But with Salmonella, the clinical signs with a Salmonella infection aren't actually different than other causes of diarrhea. So we need to do testing to make sure if a horse is positive or not for Salmonella. So signs, they often start with going off their feed, being a bit depressed, not themselves. They often show signs of colic or abdominal discomfort. And particularly if you have colic and a fever, you'll be worried that maybe this might be a colitis brewing, and particularly if they have something in their history, such as they've been on a course of antibiotics, or if they've just transported a long distance, things like that. They become dehydrated pretty quickly, so they lose a lot of fluid into their gut, and they can show signs of shock and toxemia, and then within sort of 12 hours, they're usually start to pass diarrhea, which may have some mucus on it and may have some blood, and some of them have really struggled with the motility of their gut, and both their large intestine and their small intestine shuts down in terms of motility, and they go on to produce reflux, where the fluid from their small intestine backs up into their stomach, and then we need to pass a tube and relieve that reflux and take it off. If a horse has a fever and is a bit colicky, it can be very useful to look at their mucous membranes. On the far left is a horse that's just gone off its feed and it's a little bit yellow. In the middle is a horse that's got these really bright red injected mucous membranes, and that tells us that that he's quite toxic, and probably no matter what's wrong with him, he is pretty sick. And if you flip the mucous membranes and you see this guy on the right, where you've got this blotchy, bluey color, this horse's cardiac output is really, really poor, and his oxygenation is really, really poor, and this horse is unless he gets quite a lot of help in the next, in the short period, he's at risk of dying, basically. And so again, you want to try and get them in the early stages, not in the stages where they're purple. Again, just some feces from cases with Salmonella infections. If they've got a fever, a little bit of colic, start passing diarrhea, which has mucus covering and this blood, again, we would be worried about it. Sometimes it's just lots of diarrhea, and it can really flood a box entirely with lots of Salmonella. And sometimes you get pure blood, which does, if a horse is passing blood, it tells us that lining or the mucosa of the gut is really, really damaged, and that horse is it doesn't really tell us if the horse is going to get better or not, but it just tells us that the disease is pretty severe. I'm not too sure if these videos are going to work, but we do tend to, when we get them into the hospital, we tend to scan their abdomens, seeing what's going on. And it's usually the large intestine is what's most severely affected, and they can have a lot of fluid filling of their gut. Let's see, I don't know if this is, oh, it is going to work. So this is a horse's colon, and the contents, you can see all that swirling fluid, and obviously that's what's coming out of its back end as well. And in this one, we're just looking at the, again, it's got full of fluid, and the colon wall is pretty thick and edematous, and again, just gives us an idea of what's going on in the horse's abdomen. We'll also look at its small intestine to see if that's working. If we've got lots of distended loops of small, it's more likely that the horse is having a real issue with its gut, and it may go on to produce reflux. So yeah, scanning these horses can help us quite a bit. We also tend to do blood work on them, and you will be looking to see the sicker horses tend to have high pack cell volumes. So some of these horses, they can have pack cell volumes over 60, up until 7, some of them can be as high as 70, 79, although those are the really, really sick ones. We look at their white cell count. For most Salmonella infections, they tend to be pretty low, so you might get a white cell of 2 or 3, and you might, the lab may report seeing immature neutrophils or banned neutrophils, or report toxic changes if they've looked at the blood smear. So again, that doesn't tell you what bacteria it is, but it does tell you that they're super sick. And biochemistry, we look at their kidney enzymes to see how dehydrated they are and if there's concurrent renal issues. We look at their serum protein levels, because if they're really, really dehydrated and their serum proteins are really low, it tells us that they've lost a lot of protein into their gut, and it tells us what treatments they're going to need, and also it gives us an idea of the severity of the infection. They often get quite wacky electrolytes, so again, good to look at. And we'll do a blood lactate as well to give us an idea of how well the horse's body is perfusing, and if it's high, then that tells us that horses are sicker than others. How to diagnose Salmonella infections? Well, we talked about the infection being shed intermittently, not all the time. So one fecal sample isn't enough to often to diagnose the infection. We need to take multiple, so we tend to run 5 samples taken 12 to 24 hours apart. Our lab will do enrichment stages to increase the chances that they grow up the bacteria, because it can be hard you can get overgrowth of other bacteria and not isolate the Salmonella. It takes between 3 to 5 days to get the final results. So during that time, you'll be making sure to keep these horses isolated from others. You can also do a PCR test like they do in COVID, testing for COVID, to looking for the DNA of the Salmonella in the fecal sample. It does give it results in a quicker turnaround time, and it's highly sensitive, but it can be picking up both dead and live bacteria, so not necessarily the source of the infection, and we can get false negatives where the horses go on to culture, but their PCRs are negative. So again, we use a combination of the tests, but the simplest one is the 5 fecal samples taken 12 to 24 hours apart from each individual. There's certain reasons why we mightn't grow up Salmonella. If they're producing really, really watery diarrhea, so particularly in foals, it could be diluted to really low numbers in the sample, and the lab may not be able to culture it up. So certainly a single negative test doesn't tell you very much about the status of the horse. Sometimes people say, oh, well, I tested him and he's negative, but they've only taken 1 sample, and 1 sample is just not enough. Some people take fecal swabs, particularly of foals, but there's just not enough fecal sample to give you a good idea of whether a foal is positive or negative. The lab needs, a couple of grams of feces in order to have a better chance of growing it up. If they just get a fecal swab stuck into a rectum, it's really not going to be of much use. If you're trying to run tests on a horse and it's going to be a while till you get to submit them to the lab, please put them in the fridge, obviously in a Ziploc bag so you're not contaminating somebody else's lunch. But yeah, if you just leave it out on the countertop, often the other bacteria in a horse's fecal sample will overgrow the Salmonella and make it harder for the lab to find it. And again, yeah, submit the multiple samples. Don't just submit one or two and then lose heart, because you do need multiple fecal samples or to be reasonably confident that the horse is either positive or negative. How we treat these horses, they often are losing a heap of fluid into their gut, and because of that they lose a lot of their circulating volume, and they can become really go into shock quite easily, and need a lot of IV fluids. So sometimes we can be giving them over 100 litres a day, which obviously is quite manually quite intensive, and the sicker horses often need to be in the hospital in order to manage them effectively. We give them plasma, which in order to replace some of the proteins that they're losing, but also to mop up the toxins that are getting into the system that are making them sick. And we use anti-inflammatories such as phenidine. Horses with diarrhea are at reasonably high risk of getting laminitis, which Steve talked about just before. So icing of their feet can be really useful to just try and either decrease the chances that you actually get laminitis, or at least reduce the severity of it if you do. And supportive nursing being really important. So offering them grass, changing the fluid bags frequently, maintaining their catheter sites, cleaning off their hind legs, wrapping their tail, all these things, just trying to make the horse feel a bit better while it is under treatment, really helps to try and turn them around. In general, we don't, for adult horses with Salmonella infections, we generally don't use antibiotics, although a lot of people will be like, well, you've just gone through the bother of culturing it through the lab, why wouldn't you use them? We've said before that these Salmonella tends to be multi-resistant, so there tends to only be one or two treatment or antibiotics which we could use if we wanted to. And then with adult horses, the antibiotics that we would give might upset their flora even further, and it's unlikely to get to treat effectively where the infection is, which is in the large colon of the horse. So certainly antibiotics don't reduce the severity of the infection with a colitis, and they don't make the horse quicker to a recovery or reduce the chance that it goes on to be a carrier. So again, in adults we are unlikely to use them unless we have a really good specific reason, but we will use them in foals with sepsis because, again, they really struggle with getting over the infection, and often particularly if they've got joint infections or bone infections, they'll need help in getting rid of the infection. And it's more likely in the foal to get into their bloodstream and localize out to other areas. Complications of colitis, well, laminitis being a really, can be a real performance, not performance limiting, but certainly in the broodmares be a major problem, giving them sore feet and reduce their career in terms of being a broodmare. We can get infection or thrombosis of the vein where the catheter has been, or in other areas. So sometimes it's not where the catheter was, it's on the other jugular. And this is mainly because when you've got a lot of inflammation activated with the colitis, their coagulation system or their clotting system also gets activated, so they can throw clots to multiple areas, including their veins and their colon, which this horse has. This is a PM photo of a horse that's thrown a clot to a segment of its large colon, which obviously made this horse super colicky, and it wasn't able to survive that. They can get kidney dysfunction, which can lead on to chronic kidney issues, secondary infections such as peritonitis, or even just infection localizing into their digital sheets and other things. And circulatory failure and death is also possible. Sometimes a horse can get really ill really quickly and not be able to be turned around. This is a rare complication of colitis, but it's just a point about the supportive nursing, which is when you're wrapping their tails, is never wrap circumferentially around the tail or all the way around, and don't wrap anything tight around it. This horse was a horse with diarrhea that was wrapped tightly around the tail, and a couple of days later the tail fell off. So just again, we always say don't leave the vet wrap on after the horse is foaled, and don't tie anything tight around its tails. But very rarely the horse tells you that's the reason why. Prevention of Salmonella infections on farm, you really all the farms will have biosecurity or infection control plans set up to try and reduce the chance that these infections are become a problem on the farm. We do know that it's how it's transmitted, so it's been passed out in the feces. So really attention to cleanliness, keeping the areas clean. If a horse walks down a barn and is shedding poo as it goes, cleaning it up and just getting rid of it so it doesn't become a problem. Preventing overcrowding, so having as much space between the horses so they're not overgrazing on pasture or just too huddled together. Limiting possible exposure, so you don't know the status of new horses coming to an area, so quarantining them for a period until you know that they're healthy. Isolation of horses with diarrhea and also those recovering from diarrhea, and particularly you want to be sometimes we get called out to farms to scan horses with diarrhea, and nobody's wearing gloves or boots or suits or anything. Like you just don't know the status of a horse or which one is shedding. You just really want to be a horse that's shedding diarrhea. Just be cautious about disinfecting and wearing barrier precautions, that you don't bring it around to other areas of the farm. Hand hygiene, either alcohol, sanitizers, or wearing gloves if you're dealing with diarrhea horses, and foot dips and mats. I know that you will use lots of disinfectants on the farm, but just remember that if you're trying to clean a box that's had a horse with diarrhea, that 90% of the load of Salmonella will be cleaned by a really good scrub and clean, and then make sure to allow it to